Good evening. Happy Veterans Day to those who were in the military. It's been quite a while since I was. It was 2005, 2009. I was active duty in the Navy. I was at Naval Hospital Beaufort in South Carolina. I was taking care of the Marine recruits and the retirees in the area. So very interesting experiences I had while I was there. I did get my MBA, which gave me a little bit of ideas on how I might eventually want to start a business, which ultimately led to me launching Apollo Cardiology back in 2019. And I knew I wanted to do cardiology, so after my 4 years of internal medicine responsibilities for the Navy, I went back to St. Louis University School of Medicine and did my cardiovascular training. So happy Veterans Day to those that were out there and serving. So we'll jump into your questions tonight. Tips for dissolving blood clots. Somebody has a supravenous thrombosis in a cephalic vein and already on aspirin. So I can't give direct medical advice that aren't my patients, and not knowing more of the backstory and physically examining to confirm that that's truly the diagnosis. But you have to figure out what caused the thrombosis. It's often an issue with the structured water in the glyco-calyx. So things that improve that function would be grounding, red and infrared light from the sun. UV also expands it. Photobiomodulation may help. Saunas may help. Grounding, that would be the starting points. And then, potentially, something like nattokinase or serrapeptase may be of note as well. But you'd have to talk to your doctors if that's safe with anything else that you're taking. Is salt really the cause of high blood pressure? In some individuals it is. The glyco-calyx, which is the protective gel coat that lines the arteries, it's a buffer for sodium. So if your glyco-calyx is getting disrupted for other reasons, then you might not be able to tolerate a higher salt diet. If the glyco-calyx is disrupted, then the underlying endothelium cannot produce nitric oxide. And without nitric oxide, you can't dilate your arteries very well. The arteries get stiff and blood pressure goes up. So that's one of the ways that it has an effect on it. It also tends to have an effect on aldosterone. You start holding on to more water, and then that raises blood pressure as well. So not everybody's sensitive. You can do a cardiac genetic test to figure out if you're likely salt sensitive. Next question up, is Tadalafil a nitric oxide inducer? No, it's a phosphodiesterase inhibitor. It prevents nitric oxide from being broken down. Does it last 24 hours? Tadalafil generally does. And can you take it daily? Many people do, but it's not a risk-free medication like anything that you put into your system. Some guys have vision changes with it, headaches, back pain. You can also have hearing loss with this. So, have to talk to your doctors about the risk benefits of taking something on a daily basis like Tadalafil. Question about grapeseed extract, olive leaf extract to help with heart health. There would be polyphenols and antioxidants, so may help the glyco-calyx. I particularly don't use these in my practice. There's a lot of other things that have way more data behind them that I have different devices in my office. I can show people that their arteries are getting better using those products. So not likely to be harmful, but they're probably fourth or fifth down on the list. You weren't born requiring any supplements or medications. So like I told the patient, or say the person asking earlier, do things that improve the structured water in your glyco-calyx, and that's grounding, red light therapy, sauna, sunlight exposure to your surfaces. That's where I would start. What are the best supplements to help endothelial health? First off is figure out what's damaging it if possible. If you have elevated homocysteine, then a methylation support vitamin may be useful. If you have high uric acid, you may need to change your diet or take something that helps you clear uric acid. And then there are various nitric oxide promoters. The ones I tend to use are Neo40, N101, and Vascanox. Those are the three big ones I tend to use for nitric oxide promotion. What is the best heart-healthy diet? The one that has the most data behind it is likely the Mediterranean diet, but it really depends on your, basically your mitochondria. If you do 23andMe, you can get your maternal haplotype on there. That'll tell you where your people originally came from. You inherit your mitochondria from your mom. So the healthier your mom and your grandma are, that's going to determine kind of what diets you're likely able to tolerate. Always prefer people eat a seasonally appropriate diet to where they are on the earth. If you're living in the 20s latitude, north, the 20 latitude south, you have access to sunlight with high UV, 365. So, fruits grow 365. If you're in St. Louis, where I'm at right now, days are getting shorter. It's dark at 5 o'clock or earlier. Not a lot of things are going to be growing pretty soon. So more animal-based in the wintertime. So it really depends on your mitochondria and where you live in the world. And then I probably won't go deep into this one because I've answered this one multiple times and had many, many videos on them. But thoughts on statins. I always tell people they're tools. Not everybody are going to tolerate them, either because they're going to have muscle symptoms or it's going to raise their blood sugar. But for people who've had prior heart attacks, strokes, stents, bypass surgery, they do have data that they really reduce you having a second event. It's not about making your labs look pretty. It's about not dying of a heart attack or stroke. What is the most important aspects of microbiome health on heart vascular health? Well, your microbiome is what, digests your food, and that's what gets through your enterocytes and then into your liver. So, the healthier microbiome, the healthier, your vascular system tends to be. But, your microbiome is more complicated than just taking a probiotic and making sure that it's going to take there. You really don't know that. It's much important to get your circadian rhythms all set up. Been talking about that for a long time. Reason still wearing the glasses since 2017 to keep my circadian rhythms entrained. Your gut microbiome is programmed by the light that enters your eyes, the light that hits your skin, and that's what informs your gut, what's going on. So if your gut's not working well, you're probably not getting the right light signals in the eye during the day, which is natural sunlight, limiting the artificial light. You may not be getting enough red light from the sun on your abdomen. Most people are covered up and closed, pretty routinely, unless they're out at the beach or the pool. The light in your gut needs to be seen, and those bacteria talk to each other with other light signals. So if your gut's not working well, it's often a light deficiency issue. All right, next question. TMAO, trimethylamine oxide. Looks like it was a younger person, has a high level, reports all their other Cleveland Heart Labs were okay. Can they eat protein on this? So trimethylamine oxide, it's a product made in the liver. After the gut microbiome breaks down carnitine and choline, it gets produced in the liver if you can't break carnitine and choline down effectively. The Google searches can tell you that you can't eat red meat or fish or eggs. It's more complicated than that. It doesn't mean it's a sign that you have an unhealthy gut microbiome. So the answer to the previous question about getting your abdomen out in red light or using red light panels, eating seasonally appropriately, don't eating when it's dark out, and getting the right light signals to the eyes is where I would start those things. Now, sometimes people can take probiotics and maybe it gets better, but rarely is it something that you have to necessarily make major dietary changes. The one thing I have seen people have issues with is if they're taking L-carnitine supplements. Sometimes they'll really shoot their TMAO levels up if they're on L-carnitine supplements. Carotid ultrasound came back no plaque. Odds I have plaque somewhere else. Where does it form? So it's going to depend on how old you are. But the story is you have 60,000 miles of blood vessels. So you have to go looking in multiple territories because it may not be everywhere at once. It depends on, other things that are going on in your system. So, there's about an 80% correlation with what goes on in your carotid arteries is what's going on in your coronary arteries. Meaning if you have plaque in your carotid, there's a better shot than not that you have plaque in your coronaries. But I've seen it where your story is normal carotid ultrasound and very high risk CT coronary calcium scans. Rarely do people do imaging in their brain, but if you get a MRI of your brain for some reason, they should be able to see the microvesicles in the brain. If there's microvascular plaques, carotid, you just said you had done. Calcium scores for the coronary arteries, or clearly CT angios for the coronary arteries. In our office, we look at the abdominal ultrasounds for the abdominal aorta. If you have an aneurysm, then you likely have atherosclerosis as well. Ankle brachial indexes, where you're checking blood pressure in the arms versus the legs. If you have a difference in those blood pressures where the number is less than 0.9, you potentially have plaque in your femoral and iliac arteries. So head to toe, you got to start looking. So just one territory doesn't truly rule out that you have vascular disease. All right, I think I got through the pre-submitted questions tonight. If due to stenosis and high blood pressure, I may need stents, how to avoid them and lower blood pressure. So I don't know where you're meaning. If it means you have a renal artery stenosis, that would be the only reason you potentially would have high blood pressure. Having a coronary stenosis would not necessarily lead to high blood pressure. It's a cause of you having plaque in the coronary arteries. But if you are wanting to try to avoid stents, you're probably going to need multiple medications to get blood pressures down. They're probably going to target for at least less than 130 over 80 on your blood pressure, and to be monitoring your glomerular filtration rate with likely creatinine, but hopefully they're checking the cystatin C to see is the renal artery stenosis, if that's what you have, is causing any issues with the kidney filtration. And if it is, then you need to revascularize the kidney before the kidney essentially, quote, dies. How much and what kind of salt should I take? Generally, you want to get, non-fluorinated, salts. Typically, sea salt. Generally Celtic sea salt. French sea salt is usually what I would recommend. How much depends on how sensitive you are to it. But less than 2 grams if you have heart failure. But if you quote, normal kidney function, normal heart function, it depends, maybe 4 to 6 grams a day. Can gut dysbiosis cause artery plaque? Depending on how much oxidative stress and inflammation is produced with gut dysbiosis, yes, it potentially could. Another question, how does measuring nitric oxide levels tell you about your redox status? If you have low nitric oxide, you're going to have likely poor vascular function, and if you don't have good vascular function, you're not going to be bringing oxygen nutrients to the mitochondria so that they can, make ATP, water, carbon dioxide, and water. So low nitric oxide is going to likely lead to lower redox potential. That's a good question. I haven't been asked that one, I don't think. Can an endopat test be done if high stenosis and high blood pressure? Again, it depends where the stenosis is located. If you have a subclavian artery stenosis, then potentially you're not going to have a valid result on that arm. But if the stenosis is in the carotid, the coronaries, or the renal arteries, the endopat test is not going to be affected by that. We're looking at the brachial artery being occluded for 5 minutes, and then looking at the peripheral arterial tone in the fingers. Somebody's asking, which glasses do I wear? These are my EMR Tech Wolverines. This is my kind of favorite pair to wear day to day. I have multiple pairs. I used to joke I had more pairs of blue blockers than I do shoes. That's probably not true at this time. I have tried many different vendors. I just like the way that these fit and the lenses look on me. Is there a connection between years of overeating sugar? Let's see. Sugar-rich and fatty foods and plaque. Is plaque made of sugar and bad cholesterol? Okay, so the first question, the longer you kind of quote eat poorly, the more chances some of those things are going to cause oxidative stress and inflammation, and that will damage your glycocalyx, which is the protective gel coat lining your arteries. High insulin, high glucose are some of the things that will significantly damage the glycocalyx over time. Is plaque made of sugar? No, it's mostly made of oxidized phospholipids, oxidized cholesterol that's dropped off there by lipoproteins. So there's no such thing as bad cholesterol, there's just lipoproteins. And there's different monocytes, which are white blood cells that come in there and basically gobble up the damaged cholesterol and then become macrophages. And then there's different interleukins and cytokines and scar tissue and calcium. There's a whole kind of gruel that develops in the plaque. And if the plaque builds up slowly, your body may be able to stabilize it. If the plaque builds up to where you're at a 70-80% stenosis, you may have symptoms with exercise. You may have angina or chest pain or shortness of breath or exercise intolerance. If the plaques rupture, then you have a heart attack. Think of the plaque as like an iceberg. It's growing, and eventually it ruptures. And it's the rupturing of the plaque that causes the blood to clot. Now you have 100% stenosis and you got a big problem. All right. Somebody has, I think says, has a provider recommended Metamucil for cholesterol reduction? Thoughts on efficacy? It's not very effective at all. I don't know the percentage-wise, but I would suspect you're not going to see more than a 5%, maybe 10% reduction in lipoproteins. Now, if you need to take it for bowel regularity, that's one thing, but I would not take it as a significant lipid-lowering therapy. Can red light therapy help with artery plaque? I would say potentially. Those studies have not been completed, but biophysically makes sense. The red light helps structure the water down the areas being treated. So you have to treat the artery location and have the light directly over it. So preferably you'd have a battery-powered device so you can minimize the electromagnetic frequencies, the EMFs, that are coming off the other types of devices that you would plug into a wall. Any thoughts on lactoferrin to dissolve clots? I do not have any experience with that. So, does anxiety cause high blood pressure? It's probably kind of a, I don't want to say it's a chicken and egg thing, but if you have anxiety and you have high cortisol, you have high norepinephrine or adrenaline, then that's going to constrict your arteries and raise your blood pressure. So when our patients come to our office and they tell us they have, quote, white coat hypertension, or that they're very anxious to get their blood pressure checked, we monitor their blood pressure, but we also check their heart rate variability to give us an idea, well, how sympathetically driven is that individual? If they have high sympathetic dominance and low parasympathetic dominance, then yes, anxiety is probably the bigger driver for their high blood pressure. Now, there are certain genes, catecholamine methyltransferase being one of them, COMT. If they have a SNP that's abnormal for that, it takes you longer to break down norepinephrine or adrenaline, and that's associated with higher blood pressure in those individuals. All right. Can't see if that's CA. I think that's California. It says, do I see patients virtually? I think it says I'm in California. I can't tell for sure. Can I order scans, then go over? So my practice of polycardiology is located in St. Louis at this time. To establish care with us, we do a 2-part deep dive with patients. The first visit is in town in St. Louis so that we can do the non-invasive testing. So carotid intimomedial thickness scans. We can send you off our calcium score or clearly scan if you've not had one. That's the only thing that's not done in our office. But we do the pulse wave velocity, we do the endopap, we do the abdominal aortic ultrasounds, we do the ankle brachial index, we do the genetic testing drawn that day, we do the Boston Heart Lab or the Cleveland Heart Lab panel that day. And then when those results come back, usually within 2 weeks, then the follow-up visit via Zoom can be done if you don't live in the general area. But we've literally had in the past 4 weeks 2 individuals from Australia come to see us, And last week we had somebody from Dubai come see us. So if it's possible, consider making a trip to come see us in St. Louis if you really want us to work with you. I don't have a license in every single state, so I can't prescribe things in states for patients that I don't see first. How low should people keep their saturated fats? It depends on, is it affecting your lipoproteins? And then, is it causing any issues with kind of inflammation? Most times, saturated fats for most people are neutral, but some people, saturated fats really will raise their lipoproteins. So it's individualized. I tend to use the Boston Heart Lab cholesterol balance test, the fatty acid balance test, and then potentially some of the genetic testing with Cardiacs or GB Insight to really tell people, do they likely have an issue with saturated fat? Potentially maybe they have an issue with lipoprotein lipase, for example. Then they do got to be careful with pretty much all types of fats and not just saturated. Why does the body produce gallbladder stones and kidney stones? Outside my area of expertise, but it's going to be an issue where you're potentially dehydrated. Either you're not drinking enough fluid or your mitochondria aren't making enough water. You may be taking certain supplements that concentrate and cause stones. So don't know for sure. Also, I said, thank you for my service. You're very welcome. That was my pleasure. So what test is better, a CT coronary angiogram or a calcium scan? It sort of depends, I would say. What is more sensitive? The CT angio, but at a cost differential of probably 15x. You can get a CT coronary calcium scan in St. Louis for about $100. But to do a CT angiogram, if you just did a traditional CT angiogram, probably about $600, $700 to do that. But if you want to have AI interpret the images and tell you what type of plaque you have, that tacks on another, I think, $750 to $850 now. So you're looking at generally about $1,500, $1,600 to get that information. So I usually tell people, like, how old are you? Will determine if you should consider one versus the other. And then what other risk factors do you have? Somebody's asking, how long is my wait list? I think my next available appointment for a new patient to do a deep dive is in the first week of January in 25. So not too far into the future. And you're very welcome. I enjoy doing these AMAs. It's something that back in the COVID days, I had a 6-week program that I was doing initially via Zoom, and it was just an hour-long lecture and then some AMA at the end of it. And then COVID kept going on, so I said, well, why don't I just keep doing these AMAs? Zoom got a little bit clunky to take too many people into it at some point, so I said I'll switch over and do these Instagrams. And for the most part, unless I'm traveling and in a time zone where it's too difficult to sync it up with 6 p.m. Central Time, pretty much hit them for the last 4 years. So keep doing them Monday, 6 p.m. Central Time. I just did different podcasts last Friday. So I usually record some podcasts on Friday. So you'll be seeing those in the near future. And then I started building out my kind of podcast studio in my side office off Apollo. And so I'll start putting together some longer form content there. This past weekend, I did a super deep dive on AI's use cases for my practice as well as healthcare in general. I have a lot of great ideas on how that's going to benefit my patients. I'll probably use some of it for some of my educational resources as well, so be on the lookout for that. All right. I think I got one more question. I'll answer this one, and then I'll log off for the night. I got some AI stuff I want to try to teach myself tonight. All right. So last question for the night. Do I work with patients who have already had a heart attack in the past? Or, okay, so had a heart attack in the past, but do not want to... got it. Do I work with patients who have already had a heart attack in their past, but now want to prevent another one or future one. Absolutely. This is exactly what our practice is set up to do. I was an invasive cardiologist for many years, taking care of people in the cath lab, when the plaques would rupture. But I always knew there was a different way that we had to get to these patients before it was kind of too late. So if you've already had a heart attack, that's unfortunate. But if you improve the health of your endothelium and the glycocalyx, I talk about with my patients, think of it like a force field. If you put that force field back up, you're much less likely to go down the road of having another event. And that's really what we're trying to do at Apollo Cardiology. So, knock on wood, the past few years, I honestly can count on my hands, one hand, how many times my patients have even been in the hospital in the past 5 years. And I honestly cannot imagine or suspect anybody's had an unscheduled coronary event. Had a couple patients get some elective stents because medications alone weren't controlling their symptoms. I don't see that necessarily as a failure of practice, but having a heart attack, if you keep oxidative stress and inflammation low, keep nitric oxide high, and do something to modulate the lipoproteins if they're out of balance, you're generally going down the pathway where you're rupturing plaques. So, all right, guys. Well, happy Veterans Day to those that served. Hope you guys have a great week, and I'll see you guys next Monday, 6 p.m.